The chair lays out Senate Bill 792 and recognizes its author, Senator Perry, to explain the bill. I understand there is a committee substitute. Senator Perry sends up the committee substitute. The chair lays out committee substitute for Senate Bill 792 and recognizes its author, Senator Perry. And before I do that, the chair recognizes Senator Buckingham as being present.
Thank you, Madam Chairs and members. In 2017, the Rural Health Quarterly Health Report Card gave Texas an F ranking, 44th in the nation for rural access to dental care. Last session, we passed SB792, which allowed for telemedicine and telehealth services in Texas. Because the dental board was not mentioned in the legislation, teledentist services did not apply. Senate Bill 792 incorporates oral health care into the state's telehealth statutes through teledentistry by creating a definition for teledentistry services linking patients directly to the dentist, specialist, and dental hygienist. Teledentistry allows for dentists and dental professionals to communicate and share patient information, allowing rural residents additional access to healthcare professionals. It would also help reduce the number of visits and travel time to see a dentist specialist in a more urban area. The bill requires informed consent with a teledental service provider. The bill requires dental board to adopt rules and ensure adequate supervision is in place. Controlled substances may not be prescribed over teledentistry. The sub drastically scales back the filed version by removing the following sections: collaborative practice, expanded setting locations where a hygienist may provide preventive care under their scope, the allowance of a hygienist to obtain a Medicaid number. It adds a dentist may not oversee more than 2 non-dentists through teledentistry, and mandates an in-person visit with a dentist within 12 months. So, and Madam Chair, we will need to pend it. We found a legislative draft error. We haven't gotten back from legislative council the actual bill, and in the day we got the draft, and there's some language in there that's inconsistent with the intent. It's a drafting area. So we will need to pend it just for that purpose, and hopefully can get a floor vote once that sub is approved officially. But I will say it this way: 792 was an attempt to expand access for dental care. The courts more and more every year are moving towards telemedicine, teledentistry, and opening up those doors. I'll be perfectly frank, the TDA beat the crap out of this bill and took pretty much every provision out of it that was expanding access, to the point that they actually said, you know, those people in rural communities drive to the city for groceries, so they can drive to the city for dental. I will say, and I love my dentist, but it's hard to get into my dentist a year out, and they don't work more than 4 days a week. Most people grocery shop on Saturday, so that kind of commentary is offensive. Dental care is important, and until we produce enough dentists to cover it, I think the courts, not this legislature, but the courts will ultimately rule that access has to be granted, no different than what they did with telemedicine. So this is a precursor to what's coming. I'm not trying to invade scope practices. I want licensed professionals doing the appropriate care at the appropriate level, and I've been a supporter in that venue. But until we can meet the needs of the people in my rural districts, I will be an advocate for what it takes to get their needs met. So 792 is not what we hoped it could be by the time it gets out of here, but it is a step in the right direction. It's better than what we have today. And just to put everybody on notice that I believe that it will be a decision outside of our system, no different than where medical telemedicine came from a couple of sessions back.
Thank you, Senator Perry. As the daughter of a dentist in a rural county, I appreciate that very much. And yes, rural people and our people deserve good dentistry as well. So we'll continue to work on this.